All right, hello all. My name's Tyler. I'm a fourth-year medical student at the School of Medicine. Thank you for the opportunity to discuss our ongoing research project preparing clinical medical students for the OR using pre-surgical clerkship video orientation. So as the leadership in the surgery interest group at the School of Medicine, we've noticed that most medical students are first encountering the surgical environment during their third-year clerkships. As part of that clerkship, we do a OR orientation, which in the literature has shown improvement in medical student overall comfort and self-reported performance in the OR. But these orientations focus primarily on the technical skills of surgery, so suturing, scrubbing, gowning, and gloving, etc. And in discussions with the medical students here and in the literature, clinical medical students still have some insecurities with information not discussed in these orientations, such as the actual workflow of the OR, their role as students in the OR, and then the intraprofessional team. And the best educational impact in the OR is found in students who have the knowledge and comfort to be able to integrate into the team and really experience the whole environment. So it was our objective to determine if an enhanced orientation with a video intervention discussing the interprofessional team, the workflow of the OR, and tips and tricks for the medical student's role would overall improve medical student preparedness, comfort, learning, and engagement in the OR, and possibly interest in surgical careers. So after we received grant funding through the AHSE and then IRB approval, we discussed with operative staff in the OR the best things to include in this video orientation, produced that, and just began implementing it last month. So the implementation of this 15-minute novel in a video orientation is for the third-year clinical students who are in their surgery clerkship. Those students are randomized into either the control group, being the traditional OR orientation, or the experimental group, the traditional orientation plus the video. They all have the opportunity to opt out of the study without penalty. So all of these students will complete a pre-orientation survey as a baseline, be randomized into the different groups, receive the intervention, and then complete a post-orientation survey. Our primary endpoints that I mentioned, we're going to evaluate our medical student knowledge, which is evaluated by multiple choice questions in the survey. Overall medical student preparedness, comfort in the OR will be evaluated with self-reported responses on a 5-point Likert scale in the surveys. And then overall student learning we'll evaluate by correlating their final clerkship grades. As I mentioned, we're in the implementation phase, and we just completed our first round of students, unfortunately with poor response and completion of the surveys. So we don't have any data to discuss today, but we are working to improve that completion so that we can continue collecting the data, analyze that, and then return to discuss these results hopefully next year as we continue over the next year. But it's our belief that this additional video orientation will be able to focus on the intraprofessional teams, the workflow, and medical student tips and tricks to improve their overall preparedness, comfort, engagement, and overall learning during their third-year clerkships in surgery. So thank you again. I'm happy to answer any questions that you have.
Question?
Actually, sorry, it's a comment.
Please.
Is there a way to turn the lights off on the screen so we can see a little bit?
Great.
There's like 100 light switches.
Yes, there are.
They usually